Hello, everyone. This is Jocelyn with the Almighty Network. On the phone lines, I have with me on today Dr. Rami Zebian. He is a pulmonary critical care specialist for MUSC Health. Hello, Dr. Zebian.
Hello.
Pleasure to have you here. We are, in the midst of a critical situation here in our world, in our state and nation, when we're dealing with COVID-19. And so we wanted to talk with you, or want you to talk with our listeners in reference to this situation. And also there are some entities that we want to target that you have pertinent information, important information for our listeners. First, let's talk about the social distancing when it comes to the disease and what we as people need to do to protect ourselves and to protect others.
Absolutely. Thank you for talking to me. I think you and the media have a huge role in this. This is something that we all have to work on together. And social distancing is my ask and my plea from everybody in the community to help us go through this. Like you said, this is a situation that the state, the nation, the whole world is going through, and each and every one of us has a role in preventing this. We have excellent medical capabilities, but it is limited in quantity. And if we do not practice social distancing and try to slow the spread, we are going to all be in big trouble. Social distancing is multifaceted, and we've seen directions from the CDC, from DHAC, from the governor, from the president, and there are a lot of things that we all have to do. We should not be in huge crowds. We should limit going to events, restaurants. We should protect our family members. A lot of people will say, well, I'm healthy, and if I get the virus, I may be okay, or I may recover from it. Well, not only we don't do that, or we don't know that, but we owe it to our neighbors, to our family members. We really don't want to be vectors of transmission of this disease. It is my plea to everybody to practice social distancing. Everybody can make a difference. And I think your role in the media has a huge role in spreading that message, and thanks for doing that.
Oh, yes, definitely. Now, there are lots of different posts and information, and I guess now people are really reading more than they usually do. And some of the things that people that have out there, like remedies and different things they say you can do in order to. Now, let's talk about those certain things that may be out there and people looking at them and thinking that they can utilize that to help. Can you address that, please?
Absolutely. And I think that part of the efforts that we have to do is rumor control and making sure we have reliable resources.
Mm-hmm.
I would encourage everyone to make sure they have reliable resources. Use the CDC website, use the WHO, use university hospitals that can give education. I would encourage everyone, if they have to choose between what I am telling them or what's on the CDC, please go to the CDC.
Mm-hmm.
I take all my information from the CDC and reliable resources, but you see everybody posting on social media,
Right.
on Facebook, on internet browsing. It is good that people are educated and are looking for information, but we practice this in our facility. One of the things that we're going through as a system is rumor control, and we need to make sure that there are reliable resources that we take our information from. This is serious. We need to take this seriously, and there's plenty of useful information. And to be honest, there's plenty of information that is not useful and, frankly, not true.
Mm-hmm. Yes. Well, thank you so much for addressing that, because I have, I've seen several posts out there with different things, remedies. This will do it. This will do it. This will handle it. So, I really appreciate you addressing that. Now, MUSC Health is preparing, or they have a drive-through testing site. Could you please talk to our listeners about that?
Yes, that is something that has been live since Tuesday this week.
Mm-hmm.
We really felt the need in the community to get people tested, and we really have to address that need. We want people to get tested if they have the disease, but we want those testing to happen outside the emergency room for two reasons. Number one is if somebody is sick or has an illness, we don't want them to infect others that are going to the emergency room for another reason.
Mm-hmm.
And secondly, if that person is going to get tested, that doesn't mean they have the disease, and we don't want them to catch something from the emergency room of somebody who is there.
Right.
So we believe that this will be a safe way to get people tested. It is a drive-through, like you said. People will go through it. They will stay in the car. They will make sure that there's an order. And I'll circle back to that, but we'll make sure there's an order, and then they will get the specimen collected. They will drive out, remain in their quarantine. One important thing, and I really can't stress this enough, that this is not a drive-through as in walk in or you just drive through, get tested, and leave. You have to have a physician order. And right now, the only way to do it is to go get a virtual visit, musc.care. You use the code COVID-19, and it's a free of charge visit. And you will get evaluated. You will get instructions. Say you are moderate risk or high risk. You will be called for an appointment to get scheduled, and instructions on quarantine or stay home, practice social distancing and isolation. Make sure you don't infect others. So that is very, very important. That this is not a walk-in or drive-through where somebody can just walk in and get tested. You have to go through the virtual care and get evaluated. And if you need to be tested, someone will call you and get scheduled.
Okay, now you just said virtual care. Talk to us about virtual care, and then we'll get back to this process of the drive-through testing again. Virtual care.
Yeah, so virtual care, MUSC Health has been a leader in telemedicine, and there's various platforms in doing telemedicine. One of the things that we really need is meeting the needs of the community is evaluation of patients who have symptoms, respiratory illnesses, cough, shortness of breath, fever, that they need to be evaluated, but also they don't need to go into a doctor's office for the same reason. You don't want to infect others, and you don't want to catch an infection. So that will be a telemedicine visit or virtual care. People will log on to musc.care. They will use the code COVID-19, and it will be a free of charge visit. And then they will put in their symptoms, and a healthcare provider will let them know what is recommended. And a lot of times the recommendation is, yes, you need to be isolated. Please be at home, quarantine, protect others, and someone will call you for an appointment for testing.
Oh, okay.
And then
I'm sorry. Go ahead.
Getting the phone call.
All right. This is good information because virtual care is vital and important. So everyone, musc.care is the site where you go for virtual care. And you said COVID-19 and your symptoms. You put your symptoms in. Explain that process again for us, Dr. Zebian.
So it is very self-explanatory. When you go on the site, if you put the code COVID-19, it will be free of charge.
Right.
And then you will hit a button that says Get Care Now, and then you will go through the process. It will ask you what is your symptoms, what's going on, and you just go through it. It is designed for non-healthcare people to use it.
So it's very user-friendly.
Everyone that needs it to try it, most of the feedback that we've received has been great. People find it easy to use and get what they need.
Okay, that's great. That's great. That is user friendly. Again, everyone, that's musc.care. Then you put in the code COVID-19, and it's free of charge, and then everything else runs on from there. Now, again, with the drive-to testing, please stress again that you have to have that physician medical order.
Correct. So after that virtual care visit, at the end, at the conclusion, a lot of people will get a message that says, you are at moderate risk for COVID-19. Please wait for a phone call. Our scheduling department will call you to schedule an appointment for you to get tested. And then people will get a phone call and somebody will say, okay, tomorrow at 11:35 is your appointment to get tested. People will stay in their vehicle, go through the site, and get tested. Now, not everyone that will use the platform will need testing.
Mm-hmm.
Somebody calls and they don't have the symptoms. Let's say somebody says, well, my shoulder is hurting, and I've read online that this could be COVID-19. Should I get tested? And the answer will probably be no. It will be at the discretion of the healthcare provider, but probably will be no.
Mm-hmm. Okay. All right. Well, and at that point, whenever the doctor gives you the order, then they will give you the location of the drive-through testing site. Correct?
The information will be at a later time.
Right.
The scheduling department will call and say, you have an appointment at this time, at this location.
Mm-hmm.
Please come at this time and get tested.
Correct. I guess that's the best way to do it, because otherwise people sometimes don't really listen and hear and aren't obedient to instructions, and they would probably come up with a site and overwhelm the place. So definitely going through a process is really good, really good. Well, I tell you, this has been so informative. Now, is there anything else that you need to tell us, Dr. Zebian, that will be helpful when it comes to COVID-19?
Yes, I really want to go back to having this as a team effort. You and me and everyone who is hearing us has an important role in fighting this pandemic. I will go back to social distancing.
Mm-hmm.
We really need, you hear a lot about flattening the curve. And what that means is that we know that a lot of people might get sick, but we don't want everybody to get sick at the same time.
Right.
If everybody gets sick at the same time, we will overwhelm our medical facilities and we won't have the capability to treat them. We are taking this very seriously, and we are looking at contingency plans and what ifs and looking through every scenario. I believe that we should prepare for the worst, and hopefully we don't need it. But I can't stress enough the importance of everyone taking this seriously and everyone knowing that they have a role in helping us through this.
Great. One question I wanted to ask you about the ventilators, the equipment here in our area. Is that going to be a major problem with the shortage of equipment for COVID-19?
It is a worldwide issue,
mm-hmm.
and it all depends on the peak of how many people get ill at the same time.
Gotcha.
Hopefully, we will be successful with our community efforts. And if we do that, hopefully we will be okay. No matter how much you prepare, there is a finite number
mm-hmm.
of hospital beds, ventilators. It is a worldwide issue. You can see what's happening in Italy. Internally, we are looking at that and looking at worst case scenarios. I've had discussions with many of the leaders and physician leaders in the system, and looking how we can prepare for the worst, and hopefully we don't need it.
Now, am I correct to say that there have been no coronavirus illnesses reported in Florence County?
Based on the DHAC website, there are no COVID-19 illnesses reported on the DHAC website. Of course, we take patient privacy very seriously, and
definitely,
if there was a case, we will not mention. However, DHAC has been very good in updating the information. I look at it myself; they've done a tremendous job, and they have. The last time I looked at it, there were 0 cases in Florence County. You are correct.
Okay, all right. Well, we praise God for that, and we as people of God will continue to pray for the world and our area, and pray for you and your staff there at MUSC Health. We just thank God for you, and I really, really appreciate you taking the time, because I know that you're, with being a critical care specialist, that you have your hands full. So, Dr. Zebian, we thank you so much for taking the time to come and talk to our listeners in reference to COVID-19. And if you don't mind, we'd like for you to keep us updated from time to time, so that our listeners will be able to know what's going on in our area.
Well, thank you very much, and God bless you.
God bless you, too. You're listening to the Almighty Network, Almighty 105.1 Florence, Almighty 98.3 Sumter, and Almighty 94.5 Orangeburg.